at Pandit Banarsidas Diagnostics, New Delhi, near Janakpur. Previously, I was working at Hindurao Hospital, New Delhi, and Deen Dayal Upadhyay Hospital, New Delhi. I have worked both in NICU, that is neonatal intensive care unit, and pediatric ward. So today, on this sunny Sunday, we will be presenting on hypothyroidism, which is a very important topic for pregnant and to be pregnant ladies. So today we will cover hypothyroidism in detail. Any queries will be answered, so please be free to ask your queries. So we will be covering whole of hypothyroidism in topics. So first and most important thing is what is thyroid. So everyone knows thyroid is an endocrine gland which is situated in the neck. It is an H-shaped gland which is at the base of the neck. So why it is important? It is important because it secretes T3 and T4 hormones, which is very important for neurodevelopmental requirements. So we will cover developmental part of the thyroid gland first. It is a bilobed gland, okay, and it is bilobed at 7th week of gestation. That is, on 7th week of pregnancy, you can see that gland is bilobed, and it starts secreting thyroid hormones, that is T3 and T4, at around 12th week of gestation, that is around 12th week of pregnancy. The T3 hormone and is more potent than T4, and surprisingly, the thyroid gland secretes T4 more than T3. So now the question arises, from where we get the more potent T3 hormone. The more potent T3 hormone is peripherally converted into T3 by utilizing T4 hormones. So peripherally means that in bloodstream, the T4 is converted into T3 via different enzymes. So what is the function of this T3 and T4? So these hormones are very important for our metabolic and neurodevelopmental. So the next question arises is, what happens in pregnancy? So the requirement increases as the fetus who is developing in the womb needs it for his development. So mother thyroid hormone is transported to fetus via the placenta. So if the mother is hypothyroid at this stage, then there are higher chances that the fetus will have hypothyroidism. The next question comes into our mind is, when to do thyroid testing in pregnant ladies. So if, like, you are planning for a pregnancy and if you know your status that you are hypothyroid, you have to do your T3, T4, TSH screening, and if it is normal, you can plan for your pregnancy. If it is not normal, then you should consult an endocrinologist and start your medications. After starting your medications, your thyroid hormones will come at an optimum level at around 4 weeks or after. So after 4 to 6 weeks, you can plan for a pregnancy. What if you don't know your status and if you become pregnant? Then in that case, you have to do your thyroid testing every 4 to 6 weeks, and then in second and in third trimester once. What happens if it is undetected during the pregnancy? If hypothyroidism is undetected during pregnancy, it will have mental retardation, growth retardation, and low IQ in the newborn. So the next question comes is, so why we are concerned about it? So we are concerned about it because it is a most common neonatal metabolic disorder. It is common preventable cause of mental, and if untreated, it can lead to severe mental retardation. So, why we are concerned is we can prevent this if we do a screening at appropriate intervals. Now, I will give you some interesting facts about the hypothyroidism. The incidence of hypothyroidism is higher in females. The incidence is higher in patients with Down syndromes. It has higher incidence in twins or multiple pregnancies, in older mothers, and in preterms. What is the most common cause of hypothyroidism? It is absent thyroid gland or partially formed gland. The hypothyroidism is associated with increased cardiac defects, that is, heart defects, cleft palate, neurological abnormalities, and genitourinary abnormalities. The next most important question is how to know whether the baby is normal or hypothyroid. There are some common signs and symptoms which we can pick or the mother can pick and they can have a consultation with pediatrics. So, what are those signs and symptoms which a mother should be aware of so that he can screen his baby or he can he can alert his pediatrician to look for hypothyroidism. So I will tell you some common signs and symptoms. Some common signs and symptoms include decreased activity, increased sleep, feeding difficulties. The baby will have constipation. He will not be able to pass stools for 5 to 6 days. Then prolonged neonatal jaundice, which is mostly unconjugated and treatable. Hoarse cry, abdominal distension because of the constipation, large tongue, large fontanelle, hypotonia, that is decreased activity, decreased reflexes, a umbilical hernia, cold and mottled skin, decreased feeding, and sometimes in some cases hearing loss. So these are some common signs and symptoms which the mother should know, and if present, then they should have a consultation with their pediatrician. So the next question arises, can we have transient hypothyroidism? The answer to this is yes. What are the conditions where we can have transient hypothyroidism? There are few conditions like maternal autoimmune thyroiditis. So, in cases where the mother has autoimmune thyroiditis, and second, and the most important is if mother is on medications for grave disease, that is hypothyroidism. So the next question comes to our mind is, can we prevent it? The question is, can we prevent this? The answer is yes. So how can we prevent it? So there are universal protocols and universal screening programs running all over the world as well as India. As recommended by AAP, that is American Academy of Pediatricians, we have to screen every newborn for thyroid. So when to start this screening program? The screening program begins at around 48 hours to 72 hours, that is second or third day of life. This is the best window period where we can detect hypothyroidism. Why we don't do it at birth? Because at birth, the hormones level changes and comes to normal values at around second or third day of life. So there are different screening algorithm present. So the most accepted one is combination of combination of T4 with TSH. So the blood is taken via cord blood or heel prick on a filter paper and is allowed to dry and then sent for evaluation. So on second or third day, we take the sample and we send it for evaluation for hypothyroidism. What if the screening comes out to be positive? If the screening comes out to be positive, we have to do thyroid ultrasonography and thyroid scan. The most important thing is if the mother has autoimmune thyroid disease, then we have to measure TSH binding inhibitor antibody in the baby. Now, the next question which comes to my mind is, what is the ideal time to test in pregnancy? So the best time is preconception, but if it is missed, so we can start with first trimester, and in first trimester we do every 4 to 6 weeks. The second and in third trimester we do only once. The next question is it treatable? The answer to it is yes, it is treatable. And we treat it with L-thyroxine, that is thyroid hormone, at a dose of 10 to 15 microgram per kg per day. And we do serum T4 concentration should become normal within first 1 to 2 weeks. And serum TSH should be normal in most infants after first month of treatment. The next question comes is how to do the monitoring, like how we will know whether the patient is improving or it is deteriorating, whether we have to increase the dose or we have to decrease the dose. So at the beginning, we have to do monitoring every 2 to 4 weeks after initiation of T4. Then every 1 to 2 months in first 6 months. Then every 3 to 4 months between 6 months to 3 years. And every 6 to 12 months after 3 years of age to end of growth. The next important question is how we give thyroxine. So the daily dose that should be crushed and placed directly on the tongue in the morning. The next question is what food to be avoided with it. So the iron supplements and calcium preparation should be avoided. Why it is avoided? Because it interferes with the absorption part. So empty stomach, we will give thyroid. After crushing it, we place it on the tongue and we wait. After around half an hour to 1 hour, you can give your iron supplementation as well as calcium supplementations. So next question is, what if the baby is missed? Like if we miss that baby during our screening. So in that case, we will see features of slow linear growth, that is poor growth in the baby, loss of IQ, that is mentally the baby is retarded, hypotonia, the tone of the baby is very low, speech disorders, gross and fine motor incoordination, and the most important part is the baby, uh, neurodevelopmental phase, which is to be corrected now cannot be corrected. What is the prognosis? The prognosis of this hypothyroidism is excellent if we do screening at appropriate time and if the diagnosis is made at appropriate time and we start the treatment at appropriate time. So the most important part in hypothyroidism is screening. If we screen with the adequate treatment and thyroxine, we can treat this most common cause of mental retardation. So yes to the screening, and I hope every lady who is listening to me will go for a screening during his pregnancy and before planning his pregnancy. Thank you. That is enough for today. If anyone has any queries, he can drop me the message.
Is hypothyroidism common?
The The first question is hypothyroidism common in newborn babies? The answer is not very common, but yes, there are cases where there are areas where hypothyroidism is endemic. And there are some high risk categories, like if the mother is already a hypothyroid on medications or already treated for hyperthyroidism. In that cases, the newborn is at risk for hypothyroidism. The next question is, can hypothyroidism be cured in newborn? The answer to it is yes, it is definitely treatable if we diagnose at an appropriate interval. So if we can screen the baby, if the diagnosis is made, we can start thyroxine and definitely it is treatable. The next question is, how do hypothyroidism affect baby? See, the hypothyroidism, the two most important hormone, the T3 and T4, is helpful in neurodevelopmental part of the baby. So, if the thyroid is deficient, the neurodevelopmental part will be affected. So, the baby will have different features, but the most feared part is the mental retardation part, which, if not treated appropriately, will lead to permanent loss. How is congenital hypothyroidism diagnosed? As I already mentioned in my slides, see, we have to do a screening after birth on second or third day of life. It is a very simple screening procedure. We just took blood via heel prick method or cord blood, and we sent that sample to uh, laboratories for evaluation. What is having hypothyroidism? Now the question is hypothyroidism. From where does he get hypothyroidism during pregnancy? The answer is during pregnancy, the fetus also required hormones for his growth. So it is transported via maternal blood to the fetus via the placenta. So during these cases, the utilization of thyroid hormone increases. So the mother get a gestational hypothyroidism. What are the norm? The next question is, what is the normal level of thyroid levels for a baby? There are no specific normal levels for a baby. We have a chart where we see the days of gestation, like the day of life. On different day of life, we have different values, and there are different values for TSH, T3, and T4. So we have to compare those values, and then we have to label it whether it is normal or hypothyroidism or hyperthyroidism. What are the complications of thyroid in pregnancy? The most feared complications of thyroid in pregnancy is cretinism, that is severe mental retardation. The other complications are there are associated anomalies which can affect the baby. So if the baby is hypothyroidism, there are associated anomalies like cardiac defect, genitourinary defects, cleft palate. But the most feared complication is the severe mental retardation, which is untreatable if missed. That is an interesting question. Can you breastfeed the baby with hypothyroidism? Yes, we can definitely breastfeed the baby with hypothyroidism. There are some feeding difficulties, but we can definitely breastfeed the baby with hypothyroidism. So that is enough for today. Thank you so much, and hope it will be a very cherishing and moment for you all, and you must be very happy with me. Thank you.